So there's two pieces of your axial skeleton that are associated with your bony thorax, and that is the sternum, which is this whole, basically your breastbone. It's the sternum, and your ribs. The sternum plus the ribs make up your bony thorax. Your ribs articulate with your thoracic vertebra in the back on the posterior side. And this is where I wanted to show you a picture so that you could kind of visualize the unique features on the thoracic vertebra. So we know this is a thoracic vertebra, and we know that because, look, there's a rib attached to it. There's a rib articulating with this vertebra. We have two places where the ribs articulate. We have here, that's actually called the tubercle of the rib, and we articulate with the body of the vertebra, and that is the head of the rib. So the head of the rib articulates with the body of a thoracic vertebra, and the tubercle of the rib articulates with the transverse process of the thoracic vertebra. The place on the vertebra where the articulation happens, are you ready for this? Visualize, if you will. The head of the vertebra articulates with the costal demifacet on the body, and there's no I there, on the body of the thoracic vertebra. Here's my body. Why is it called a demifacet? Demi, half. It's half a facet, which makes complete sense because you can't really see it here, but the head of the vertebra articulates with the costal demifacet of two thoracic vertebrae. So stack them up. I'm just going to show you so that you can visualize this. You stack them up, and I don't know, can you even see anything? You agree. Now, we have costal demifacets on the body, and if we were to attach a rib right here, the head of the rib would actually attach between the two, like a little bit on the inferior surface of the top vertebra and a little bit on the superior surface of the bottom vertebra. Whoa, did you follow that? And because it's half, one rib articulation attaches half to each vertebra, it's called a demifacet, a half a facet. The whole facet is the whole thing. That rib, the head of the rib attaches there, and then the tubercle of the rib attaches to a facet on the transverse process. So, and that's my costal facet. So my costal facet is found here, this right here, except I do not want, I need a new color, new colors. It's going to be green. Here is my costal facet. The costal facet on the transverse foramina, the transverse process of the thoracic vertebra articulates with the tubercle of the rib. The head of the rib articulates with the costal demifacet on the thoracic vertebra, the body of the thoracic vertebra. Whoa! Write that down in one little mouthful. The sternum is pretty straightforward. I think we have three sternum parts that we have to know. First of all is this tiny little bad boy down here. That little twanger is called the xiphoid process. Here it is, the xiphoid process. It hangs down. You can kind of palpate it if you grab your sternum. This is the body of the sternum. And this guy right here, the top little piece, is called the manubrium. Manubrium. On the manubrium is the suprasternal notch. That little notch right there, and you can feel that puppy. Aw, there's my suprasternal notch. You can even see it if you get your, oh, there we go. Sternocleidomastoid, which is this muscle right there, attaches to your suprasternal, attaches next to your suprasternal notch of your manubrium of your sternum. How awesome are bone bumps? The sternal angle is this thing. I thought there was one more. That's my sternal angle. And the sternal angle on, you can actually, I can feel mine. Some people have a more pronounced sternal angle, but you can feel it's a point that you can actually identify. And I think there's clinical significance in that puppy. You identify it, and then you know where to stick your, what's that thing that you listen to the heart with? That'd be a stethoscope. Shall we do the pectoral girdle next? I'm in. Let's do it. The pectoral girdle is considered part of the appendicular skeleton because even though it's found kind of medial, it actually is where the limbs attach, where the upper limbs attach to the body. So it is considered part of your your appendicular skeleton. Two bones that we have to know as part of our pectoral girdle. First is the clavicle. That's this guy. The clavicle is your collarbone. It has a sternal end, which articulates with the sternum, and it has an acromial end that actually articulates with the scapula. I think of the scapula. Look at my skeleton right here. You can barely even see the scapula on my skeleton. I think of the scapula as a posterior bone, and it is, but it has pieces that actually come up and around to the anterior aspect of your body. And so the scapula can actually, from the posterior side, can actually attach to the stern or to the clavicle, which is definitely on the anterior surface. You can see how they attach to each other here, but let's take a closer look at the scapula itself and maybe label some parts on this guy. You can see the little purple scapula, definitely a posterior bone. It's on the outside. It's posterior to the rib cage on the back of the body. But, yeah, it's an arm bone and comes around to the front. All right, ready? Let's name some parts. The part, let's name the acromion. Ready? If you look at the posterior, this is the posterior view. This is the anterior view. This is a lateral view. Does that work for you? Let's name this part first. This is the glenoid fossa. The glenoid fossa is the fossa, which is a smooth articulation where the humerus attaches. The humerus is your upper arm bone. So the humerus actually sticks into the glenoid fossa and forms a joint, your shoulder joint. Now, if the glenoid fossa is on your scapula, is it medial or lateral if it's attaching to the humerus? It's lateral. Do you agree with that? Because if it was medial, your arm would be coming out of the middle of your back. Mine isn't. I don't know about yours, but mine definitely isn't. So this is lateral. This is medial. If you look at the posterior aspect heading lateral, because here's glenoid fossa, you'll see a spine. You can feel your spine. Go ahead and palpate your scapula. You can feel the spine of your scapula. The spine of the scapula terminates in a giant bump called the acromion. The acromion is where the clavicle articulates with the scapula. So clavicle is going to attach to the acromion. You also have, if you look, okay, so here's acromion. I'm just going to make a note, A. Guess who that guy is? That's a different one. That's a little coracoid process. coracoid, the word coracoid means like crow's beak. Kind of looks like a little crow's beak right there. Acromion is big, and acromion is the termination of the spine. So if you get confused, which one's acromion, which one's coracoid, then take a look at which one is attached to the spine. The coracoid process actually comes out anterior, posterior. Although you can palpate your acromion. You can actually feel that puppy. All right. We have some flat spaces on our scapula. Here's my spine. My infraspinous process, right, is infra, below the spine. So who's this? That's my supraspinous process. It's above the spine. Now, that was the posterior view, above and below the spine. Take a look at the anterior view. I can't touch the anterior aspect of my scapula unless, I mean, there's ways you can move your shoulder to, like, have you ever had a massage person, like, reach up underneath your scapula and it feels kind of wonky, but, you know, they get in there and they actually massage your subscapularis because it is attached to your subscapular fossa. And it's smooth. The subscapular fossa is, there's no spine separating superior and inferior. And it's on the anterior surface. You can see it through the ribs if you take a look. I think that's everybody that we had to do for the pectoral girdle. Next up is the superior limb, and there's lots of people there.